Eva, and I am your student nurse for today. So, do I need to speak Bisaya, Tagalog, or English?
I can understand both.
Okay, so may I know your full name, sir?
Bernardo Turan.
Okay, so what do you want me to call you?
Inner.
Okay, so is it okay that I'm going to hold your hand to check your wristband?
Yes.
Okay, thank you. So, now the procedure that I'm going to do is that I will check some part of your skin, nails, and hair. And there's an improvement procedure that you need to follow. Is it okay with you?
Yes.
Okay, so feel free to raise your concern, and the information that I will be getting is secured and will be safely handed to the doctors. So, am I clear or do I need to repeat it for you?
No thanks.
Okay, so now we are going to the current complaints of the clients. So, now, I will ask you some questions. So, do you currently experiencing skin problems such as pigmentation, dryness, or swelling?
No.
Okay, so any food, medication that you're allergic?
No.
Or are you using some skincare products or lotions?
Mild.
Before doing the assessment, as you can see, I am wearing gloves to protect myself from the client. So the first thing I'm gonna do is to ask or to let my patient know to touch her head, to touch his or her head. So Inard, is it okay to you that I am going to touch your head to check any lesions in your skull or in your head?
Yes.
Okay. So now we are going to palpate her head or his head. You're gonna palpate this to see any cleanliness, dryness, or oiliness or lesions. And of course, don't forget to check the unusual growth of the body. So there's no any lesions in his head. Okay. So now I will proceed to the nail grooming and cleanliness. So the first thing I'm gonna do is to palpate his hand. So is it okay to you that I will palpate your hands?
Yes.
Okay. So palpate hands to see the texture and consistency. Okay. To test the category to refill the nail beds, we just need to press the nail to see the color change or to watch the color change. Okay. So for inspecting the skin and the color, look for any variation such as redness, pallor, or jaundice. And of course, upon examining, note for any other examining of the skin. So for the moisture, palpate the skin and check for any skin folds and an exposed area. For the temperature, I will use my dorsal surface of my hands to palpate the hands, like this. For the texture, I will use my palmar surface of the hands. So like this. Like that. To assess the trigger, pinch the skin. Pinch like this. Pinch the skin and not the speed and how it lifts up. Okay. And for the mobility, nothing to ease of which it lifts up. And lastly, for the lesions and edema, if there is none, no need to examine. But if it has, you should follow the method of ABCD method, which is the symmetry, a regular border, the color, the diameter, and the elevation.